my name is Stephanie Zanvetter. I'm a physical therapist here at Gaylord Hospital. My role here is a clinical specialist in stroke. And so today we're going to be talking about some of the changes and challenges that affect stroke survivors in incurring a stroke. We're going to talk about some of the anatomy of the brain as it pertains to better understanding your stroke. And so we're going to talk a little bit about some of the regions of the brain in just a second, but first to kind of understand that the brain is comprised of two hemispheres, right, or two halves. And so to understand, of course, that a stroke that occurs in the left half of your brain will affect the right side of your body, right, and a stroke that occurs in the right half of your brain will affect the left side of the body. Looking at someone, right, and you observing weakness on one side, one might be able to say, for example, if I had weakness in my right arm, that my stroke occurred in my left brain. Naturally, we cannot look at someone, of course, and know specifically where in the brain their stroke occurred. This is naturally the reason for which we have imaging that is done. This is one of the things that we encourage our stroke survivors to learn in addition to the type of stroke they've had, which we discussed in a previous video, right, whether it be ischemic or hemorrhagic, but also specifically which region of the brain has been impacted by the stroke. And so we're going to talk first about the region of the frontal lobe. That's the area in blue here on your diagram. Okay. And I'm going to flip my slide here for just a second. Okay. So the frontal lobe is responsible for a lot of really important functions, and there's a number of things listed for you there, and we'll talk just about some of them. But ultimately, a lot of your executive function skills are performed in this region of the brain. So your ability to organize, sequence a task, and to carry that task out in a stepwise, organized fashion is controlled within this region of the brain. Your ability to have a good plan of execution from a motor task perspective is also controlled in this region of the brain. And I give people the example, right, of brushing your teeth, right? So it's the idea of the tools to use, the ability to sequence that task, and then actually execute the task as well. This particular region of the brain is also responsible for your ability to express yourself or to get the words out that you wish to from a speech component. We'll talk about how speech can be impacted following a stroke in another few slides here. And it's also responsible for our emotional regulation and personality. Next region of the brain we're going to talk about is the parietal lobe, and that region sits just sort of behind the frontal lobe. You'll see there in red on the screen for you. This particular region of the brain is responsible for a lot of sensory information, and so your ability to differentiate between size, shape, and weight of objects is controlled in this region of the brain, as is your ability to demonstrate good spatial and visual perception. So we're going to kind of talk about what does that mean. Ultimately, an individual's ability to kind of know vertical or know straight or upright, if you want, without a line being drawn, right? Most of you seeing me now can see that I'm standing up nice and straight, right? But if I kind of lean off to one side here, right, you're looking at me saying, oh, she's leaning over. An individual that has difficulty with this type of spatial or perceptual impairment may not recognize, right, that they are leaning over. And to them, right, this is straight. And that has to do with respect to the particular region of the brain that has been impacted. When we see this in therapy, ultimately there's a assessment that we'll do and some treatment that we'll work through with that individual to help them with recognition of that upright challenge and their perceptual awareness. Many times, although not always, there is a visual component. Next region of the brain that we'll talk about here is the occipital lobe. That's the area in yellow on your diagram there. The occipital lobe is responsible for vision. That being said, it is not uncommon for stroke survivors to experience changes to their vision outside of having a stroke in the occipital lobe. The next region we'll talk about is the temporal lobe. That's the area in green there for you on your diagrams. The temporal lobe is responsible for memory, for hearing, for understanding spoken language, or something we call auditory comprehension, as well as organization and sequencing. So a little bit of carryover there from the frontal lobe function as well. The cerebellum, that area in purple, is responsible for balance, for coordination, and for skilled motor activity. Many times within this particular region of the brain, an individual will have difficulty with respect to their motor control. So at times they may present with ataxia, right, where the limb is a bit uncontrolled in movements, and this can occur in the arm as well as in the leg, making it difficult for the individual to reach for objects, right, and or certainly with respect to walking, have difficulty with placing their foot where they want it to go. The other region that's not really labeled, I think it's sort of a tannish color there, is your brainstem. Brainstem is responsible for a lot of really important functions in the brain. It controls things like breathing, heart rate, your arousal level and consciousness, your sleep-wake cycles. as well as attention and concentration. What we're looking here in this slide are just some of the general patterns of dysfunction with respect to location of injury and stroke. So looking at that slide where it says right side of the brain and highlighted there in green for you are some of the most common issues related. So you'll see impairments in vision and perceptual awareness, which we talked about earlier. That's the individual's ability to essentially know vertical or upright, which can be challenging from a balance and mobility perspective. So that left neglect or left inattention, which can certainly impact an individual's ability to move within their environment, as well as safety. Decreased attention or awareness of deficits, which can be certainly problematic, again, regarding safety, as well as just judgment and insight and some of those types of things that impact, again, an individual's ability to move around in their environment. Visual deficits or memory impairments, and then decreased control over the left side with respect to movements. The left side of the brain, right, we'll see sort of in that column there in blue for you. This is more difficulties with understanding language, particularly auditory comprehension. The expressive component of language as well, which is your ability to get your words out that you wish to. We're going to talk about some of the communication impairments in a few minutes here. A lot of the emotional reactions to stroke as far as depression and anxiety can be heightened with strokes in this particular side of the brain, as well as impaired logic and sequencing difficulties, which again can impact an individual's safety with their mobility and their ability to function independently. And then you see where it says brainstem. So this is more slowed processing or thinking speed, an increase in confusion, difficulty with attention and concentration, an increase in fatigue, and impaired cognition essentially across some of the other domains. This is not an all-inclusive list, but does highlight some of the most common impairments that we see in stroke survivors. Certainly trouble or difficulty walking, which can be obviously impacted with respect to having a side of weakness naturally, and the balance that gets impacted with respect to having weakness on one side. The weakness in the arms and legs that is on one side, we refer to that, of course, as hemiparesis, which essentially means weakness on one side. There are occasions whereby the arm may be more impacted than the leg and vice versa. And this kind of tends to go into more specifics from an anatomy perspective as to which artery of the brain was impacted following the stroke. Okay? Difficulty swallowing, which can, of course, impact one's ability to eat or drink as you did prior to your stroke. Difficulty with speaking, your ability to communicate not only with the expressive component of being able to get your words out that you wish to, but also to be able to understand what is being said to you from an auditory comprehension perspective. Difficulty or trouble with vision. Most commonly with respect to trouble with vision, folks will experience difficulties with either blurry vision, double vision, or loss of vision in one part of the eye, something that we refer to as a field cut. Okay. Memory loss, particularly short-term memory, is impacted following a stroke. And then difficulty concentrating, which can, of course, impact new learning and or learning of new skills in having had a stroke. This is an important slide with respect to who's helping me with addressing these impairments while I'm here in therapies. And so we sort of have a breakdown for you of what's going on right in physical therapy, occupational therapy, and speech therapy. Your physical therapist is working with you on evaluating your leg strength, right? That's essentially the strength that you have in your strong side, your sound side, as well as compared to, of course, the strength in your side that's been impacted by the stroke, as well as working with you on assessing your sensation coordination, which can be also impacted following a stroke. Your physical therapist is assessing your ability to walk. That includes, how much help you need, what devices you might need to safely walk, the progression of that ability, as well as just in preparation for home, walking on different types of terrain, walking outside, inclines and declines, and all those things that sort of surround just navigating in your environment, right? Many stroke survivors experience challenges, of course, to their balance, and this makes sense, of course, if we're considering weakness on one side. Your ability to move as you did prior to is hugely impacted. And so your physical therapist will likely do an assessment of your balance to determine what your risk for falls is, as falls are very common in stroke survivors. Yeah. Stairs and curb negotiation, particularly as it impacts your ability to return home naturally and access your communities, and then car transfers with respect to whether or not there be a particular method or how much assistance and with what device might be best used to help you with navigating being able to get into and out of a car. In occupational therapy, your occupational therapist will evaluate your arm strength, as well as, again, sensation coordination involved. They'll also look at your fine motor coordination. Should you have hand mobility, they'll look at your coordination and your ability to move your fingers and to use them in a functional way, right? Your occupational therapist will also assess your vision, and that includes your acuity of your vision, right? The ability for you to track your vision, your attention to that side that's been impacted, right? We talked about in one of the previous slides, left inattention or left neglect, and that is a visual issue that can impact stroke survivors tremendously if, again, we're talking about mobility and your ability to navigate independently in your environment. Toileting, bathing, and dressing all fall under the umbrella of activities of daily living, which can be impacted, of course, after a stroke. And so your occupational therapist will be working with you on evaluating the method by which you are performing these tasks, how much assistance you need, and any particular tools from a technology perspective that might be helpful in your recovery as you work on navigating those abilities in a more independent fashion. Your occupational therapist will also evaluate your thinking skills, which can commonly be impacted following a stroke. We talked a little bit earlier about how short-term memory can be impacted following a stroke, how concentration and processing speed can be impacted following a stroke. And so your ability to navigate not only this new you, right, in your stroke, but also in preparation for home, and we'll talk about in a future video as far as your ability to manage your own medications, right? And some of these other types of things are very important if we're talking about thinking skills and awareness of what's going on. In speech therapy, your speech therapist will certainly evaluate your communication, and that's your ability to get your words out, as well as to, from a comprehension perspective, understand what is being said to you. Your speech therapist will also evaluate your memory. We'd mentioned in a few slides ago that short-term memory can be particularly impacted following a stroke. And this, again, is problematic for many reasons. Again, many of you are learning how to move again in this new you. And so if we think about how attention, concentration, and memory are all impacted, that impacts your ability to carry over some of the new skills that you're learning in therapy, your ability to kind of remember a task that you may have learned in a previous therapy session or on a previous day, and then carry that task over to a new skill that you might be working on in your therapies. Speech therapy will also work with you on swallowing, and that's your ability, of course, to gain, if you haven't been able to already, the ability to eat or drink as you did prior to your stroke. And so there are a number of different swallowing assessments that may be performed to help you with advancing your diet while you're here. And then insight and awareness, and this is, again, particularly important if we're thinking about the stroke survivor's future, right? And being able to, for those of you that might live independently at home, right, and having to navigate this new you on your own, from a big picture perspective, not just your ability to kind of walk and get dressed, but also your ability to manage your own medical appointments, your medications, follow up things that you might need to do with other clinical professionals, right? Some of these types of things. So having good insight, good awareness is an important component in that ability. This is just a slide. We'd mentioned some of the communication impairments that stroke survivors can have after a stroke. And so here we're going to talk just about a few of them. Aphasia is a communication impairment whereby the individual may have difficulty with being able to get their words out, as well as appreciate what is being said to them from a comprehension perspective. Dysarthria is essentially an incoordination of the muscles in the tongue used to speak, and so the speech can many times sound thick or slurred. Yeah. Oral apraxia or oral motor apraxia is a further incoordination of those muscles used to speak, and these individuals may have some severe impairments where they may not be initially able to produce sound, and so they are working in their speech therapy sessions on the ability to produce sound as far as working towards getting their words out. And this is a very busy slide, and ultimately what we're covering here is just dysphagia, which is, again, that difficulty in swallowing. And so we're not going to spend a whole lot of time getting to the anatomy here. That'd be a whole other topic, but ultimately, with respect to a stroke survivor's ability to safely swallow. And I'll go back to, we talked about weakness on one side, earlier as far as affecting the arm and the leg. But we have to give consideration, of course, it's not just the arm and the leg that can be impacted with that stroke. And so with respect to site of weakness, even those muscles that we don't see certainly can get impacted. Naturally, this would impact an individual's ability to safely swallow, right, and or eat or drink as they did prior to their stroke. In speech therapy, you'll be working with your speech therapist on, if you do have this difficulty, what the steps might be in order to advance your ability to eat or drink regularly. We spent a lot of time talking about how a stroke can impact an individual with respect to physical changes, of course, after a stroke. Naturally, this comes as a large shock to all individuals. Nobody certainly elects to have a stroke, nor is there any preparation or any advanced warning. That being said, of course, all those negative emotions that an individual experiences in life, and there's just before you a few of them as far as anxiety, depression, difficulty with concentrating, fatigue, can kind of hit all at once, and that can be certainly very overwhelming for a stroke survivor. This being said, of course, it is very important in consideration of an individual's recovery that we not only address those physical impairments through the physical therapy, occupational therapy, and speech therapy, but that the emotional aspect of a stroke survivor's recovery be taken into consideration. And all of you then can expect to be seen by a member of our psychology department, that's a social worker or a psychologist, who may be involved in meeting with you on a one-on-one basis, of course. Usually it's once a week or so that they'll kind of check in with you, unless more frequent visits are either recommended and or requested. Not all stroke survivors will experience a change to their personalities after their stroke. Some may. And so on this slide, we're kind of just looking at some of the different types of changes that an individual may experience, right? And so emotional ability is essentially an individual's difficulty with being able to manage their own emotions. These individuals may laugh or cry at times that may not otherwise be appropriate. They may recognize it but not be able to control it, and this can be, of course, rather uncomfortable for the survivor. Perseveration, sort of being stuck on a task and not being able to switch gears or change topics. Irritability, I think everybody knows what irritability is, but that is not uncommon to see. And that's understandable, right? Because we've had a big change to our former self and we're now kind of working through a lot of things. Apathy, so lack of engagement, lack of wanting to participate in therapy sessions. For some, not wanting to take medications, not wanting to get out of bed. Aggression, again, I think everybody knows what aggression is, but that can be particularly challenging not only for the survivor, but also for those around that individual, particularly loved ones that are seeing a different version of, who you may have been prior to your stroke. And then impulsivity, sort of that lack of thought before action. Right? And so to review, we've talked about a lot, but once again, we talked about the different regions of the brain to help you as a stroke survivor with sort of understanding the different regions, what they're responsible for. We talked about how it's important for you as a stroke survivor to know the region that was impacted by the stroke so that you can best understand some of those changes and challenges that you are experiencing now. We talked about the role of therapies, both the physical therapy, occupational therapy, and speech therapy, and sort of the division of labor as far as what each of those therapists are looking at with you while you're here working with us. We talked about some of the different types of speech impairments and communications and swallowing and some of the different things that can be impacted from being able to eat or drink. And then we talked, of course, about some of the emotional changes and personality changes that can impact stroke survivors in their recovery. Thanks again for watching. Again, I'm Stephanie, and I hope that you'll be able to check out some of our other videos on Gaylord and stroke recovery.